Many patients with type 2 diabetes not treated with insulin self-monitor their blood sugar levels at home. Patients like April Reese.
A couple of times a week I am testing to make sure that I'm in the right range, or if I feel like something's wrong, I test.
But how effective is self-monitoring for patients like April? Dr. Katrina Donahue and Dr. Laura Young of the University of North Carolina at Chapel Hill and their colleagues studied 450 adults who had non-insulin treated type 2 diabetes. Researchers wanted to know if self-monitoring blood glucose levels affected diabetes control by looking at patients' hemoglobin A1C levels, a measure of longer-term sugar control, or their health-related quality of life. In the randomized trial, patients were divided into 3 groups. One group did not do self-monitoring, the second group did once daily self-monitoring, and the third group monitored once daily too, but also received messages with encouragement or instruction through their meter. The study appears in JAMA Internal Medicine.
After 1 year, we found no significant differences in A1C or glycemic control between the 3 groups. Also, there were no significant differences in health-related quality of life.
The next steps are getting the message out and really helping patients understand, as well as healthcare providers, the message from the study, and helping patients feel comfortable recognizing that testing may not be necessary, especially for those who are used to doing it at once or multiple times a day.
Study results do not apply to insulin-treated patients. April Reese says the results are worth a conversation with her doctor about the value of self-monitoring.
I will talk with my doctor about these results so that we can look at my treatment plan and make some decisions moving forward about how I want to.
The United States self-monitoring blood glucose market is projected to reach a value of more than $4.6 billion by 2027. Rise in the prevalence of diabetes, surge in geriatric population, and increase in risk factors that lead to diabetes drive the growth of the United States self-monitoring blood glucose devices market.
Prepare your kit. You will need a meter, test strips, a finger pricker or lancing device, a lancet, cotton wool, and a monitoring diary to record the results. Step 1. Wash your hands first. Make sure your hands are thoroughly dry before starting the test. Load a new lancet into the finger pricker or lancing device. Snaps in there. Load a test strip. Into the blood glucose meter. This one switches on as you put the test strip in. Prick your finger at the sides as it's less painful than at the tip or at the pad, so prick it on the sides just here. Give a little squeeze. Not too hard. If you need to squeeze too hard, then take another test and prick your finger again. Just check the machine is on before you put the blood onto the strip. The result should appear within a few seconds. And there we go, it's a little bit low, 3.6. I'll need to treat that with some glucose tablets. Just clean your finger, clean the blood off the fingers, remove the test strip, which can be thrown away, and make sure that the lancet in the machine is disposed of in a sharps bin.